Hello, this is the Think Big for Africa podcast. My name, as usual, is Ekene Banye. Today, I have a friend of the show, uh, my guest for episode 5 of the show. She's back. The last time I told you that she does a lot of different things. And today he's here to discuss one of the many things she does. Her name is Ifeyinwa Favour Ezeifedi. Favour, how are you?
I'm good, thank you.
Good.
Nice to
Yes,
see you again.
yes. Thank you very much for agreeing to come to the show again. Uh, like I said, you do so many things, so many very interesting and important things as a community leader. I will be calling you back many times to discuss the many things you do. Today,
Yeah.
we are going to talk about mental health. Yes, this is important because we have seen post COVID and post lockdown an increase of people who suffer mental health difficulties. Okay. Uh, Favour is a joint service lead of the Child Adolescent Mental Health Service in East London, NHS. So she's the right kind of person to help us dissect this so that we know when people around us, including ourselves, are suffering from mental health difficulty and to know what to do in such a circumstance. So, Favour, see, let's start this way. Help me define what mental health is itself, and maybe tell us how prevalent it is in our society.
Thank you, Ekene, for having me talk about mental health today. Um, Mental health is something that is really very dear to my heart. Um, when you ask the question to say what mental health is and how prevalent it is, I wanted to start by saying that there's a distinction between mental health and mental ill health.
Okay.
So I will explain what mental health is, then I will move on to talk about mental ill health.
Okay.
And then we can talk about the prevalence of mental ill health.
Okay.
Is it okay?
Very. See, as the more you tell us, the more we understand, and hey, it's good.
Okay. So let's start with mental health.
Okay.
So all of us have mental health. So mental health is a state of being in which an individual realizes his or her own abilities, can cope with, the normal stresses of life, can work productively, and is able to make a contribution to his or her community.
Okay.
So this is a WHO definition of mental health.
Okay.
So it's a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make contribution to his or her own community. So from what I've just read, kind of said to you about what WHO describes to be mental health, it then means that mental health is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life, most importantly. So it's really mental health is part of health itself. So if you think about health, you think about physical health.
Yeah.
So the same way we think about mental health. So it's part of health. So mental health is more than absence of mental illness.
Okay.
Or mental disorder. That's why I said, most importantly, for individuals to be able to cope with normal stresses of life, work productively, able to contribute to community, and enjoy life.
Yeah.
So that means that mental health is much more than absence of mental illness. So is an integral and essential component of health.
Yeah.
So health itself is a state of complete physical, mental, and social well-being.
Okay.
Not merely the absence of disease or infirmity. So that's why it's important we understand that mental health is more than the absence of mental disorder.
Okay.
So when we now talk about mental ill health, so I will start by saying that poor mental health is what leads to mental ill health.
Okay.
So remember we said that mental health is our ability to realize or cope with normal stresses of life. Yeah.
Yeah.
So that means then there are some multiple social, psychological, and biological factors that determine the level of mental health of a person at any point in time. So there are a couple of factors that determine this mental health we are talking about. Your ability to cope, be productive, and enjoy life.
Yes.
So when these factors determine your level of mental health, so any kind of abnormality in some of these factors, both social and psychological and biological, could lead to poor mental health.
Okay.
And poor mental health is really, really associated with rapid social change, stressful work condition, discrimination, social exclusion, unhealthy lifestyle, and sometimes physical ill health can lead to mental ill health.
Okay.
So I hope I've given kind of a background
Yes, you
of
have.
what mental health and mental ill health look like. Yeah.
Yes. So how prevalent is it now?
Okay. So evidence suggests that at any point in life, 1 out of 4 people will experience mental health difficulty. So that means a quarter of any population.
That's large.
Yes. And there's emerging evidence that seems to suggest that it's now 1 in every 3 persons.
Wow.
So it's still emerging. It's not yet conclusive, but perhaps maybe it's because of the COVID lockdown. But there's emerging evidence that suggests that it's moved on to 1 in 3. But empirical evidence is 1 in 4. So at any point in time, 1 in 4 people will experience mental health difficulty. And we'll talk about different types of mental health at some point.
Yeah.
But generally, anxiety and depression, there's evidence that suggests that 1 out of 10 people at any point in time experiences depression. Yeah. So generally 1 in 4, but depression 1 in 10.
Okay.
Yeah.
So now we know that mental health, ill health, actually,
yeah,
broad. Okay. So
yeah,
just explain to us the different types of mental
So mental ill health.
ill health. Yes.
Yes. So there are different types of mental ill health, but broadly, that's quite a long definitions that we use to classify mental, which I will not. They are all technical terms, which I will not bore your listeners with. But broadly, there are 2 broad types, and one broad type is the broad that we refer to as neurosis.
Okay.
And that's what is now called common mental health problems.
Okay.
And then the other type is what we refer to as psychotic. and that is more severe end of mental illness.
Okay.
So the neurosis is things like anxiety, panic, depression. Those are the what we now call common mental health problems.
Okay.
And even within this common mental health difficulty, there is still levels of severity. There is mild, so you can hear maybe somebody say somebody is mildly depressed,
Yeah.
or severe depression, or chronic depression, or mild or severe or chronic anxiety, or generalized anxiety, or panic, or phobia. Those are, common mental health difficulties.
Wow.
Then you have the psychotic ones that we refer to, and these are the ones that may affect somebody, which kind of interfere with a person's perception of reality.
Okay.
I may include hallucination, such as seeing or hearing or smelling things no one else can hear, or may behave or act differently. So these kind of conditions are more psychotic. So like psychosis, like schizophrenia, bipolar conditions, all those are the severe ends of mental health difficulty.
So would I be right to say that for somebody to suffer a severe kind of mental ill health, at least the person will first start experiencing the mild version? Is that correct?
Not necessarily.
Okay.
Not necessarily. Sometimes some very extreme stressful condition or traumatic experiences could trigger those severe ends. Or maybe substance misuse could trigger those severe ends.
Okay.
So all of a sudden, some very stressful condition or traumatic experience, or maybe substance misuse or violence could trigger the severe end.
Yeah.
But sometimes, like you said, when some milder or common mental ill health conditions hasn't been properly managed, it could also eventually lead to somebody going to the severe end of mental health condition.
So,
but usually the onset,
yes,
the onset of some severe mental health conditions starts much later, like later in teenage years, not very early in life. So most like children, that maybe primary age children, usually will experience much more of the common mental health condition. But the onset of things like first onset of psychosis and all that, evidence suggests that it is usually from, say, the age of 13, 14, usually not less than that. Usually not younger than that.
Even then, that's young. For me, that's still very young. So what are the visible symptoms? What are the visible symptoms?
Okay. So before we go to the visible symptoms of mental ill health, I also want to explain that there are some other mental ill health that I haven't mentioned.
Okay.
So that when we are saying the visible symptoms, so that we kind of take it in general. So we talked about depression, anxiety, panic, phobia, but I didn't mention things like PTSD, post-traumatic stress disorder.
Okay.
I didn't mention something
it's so broad. It's so broad.
Yes. I didn't mention something like OCD, which is obsessive compulsive disorder. I didn't mention something like personality disorder. And there's borderline personality disorder, there's narcissist personality disorder, antisocial personality disorder. There's also postnatal depression and postpartum. There is self-harm, there's eating disorders. There are so many other conditions that are kind of on the fringes, like hair pulling and things like that. that could fall under low self-esteem, perfectionism, all those things that could fall under mild to moderate mental health condition.
Now I understand why maybe a quarter of the population might be considered to have mental ill health.
Yes.
So because see all these various things you just mentioned.
Yeah.
Yeah. Wow. Oh my.
And also there's a body image. There's so many different types of mental health conditions. So that's why a quarter of the population will experience it once.
Yes. Wow.
So in terms of symptoms that you asked me, what we could notice as to know that someone is not coping. One of the early symptoms that you will notice that someone is not coping is not caring about things they used to do or things they used to enjoy.
Yeah.
Is that is a warning sign that somebody is not coping. Feeling sad, down, or hopeless most of the day, nearly every day. And I want to put a caveat on this one. And the caveat I want to say is that all of us are on the spectrum of mental health, like I defined before.
Yes.
So sometimes your mental health is optimum, just like your physical health is optimum. And sometimes it's not quite optimum. So like if you look at it as a continuum, 0 to 100. So that means that there are times we might feel wobbly. Doesn't necessarily mean that we have mental health condition.
Okay.
There are times maybe something happened, affected how we feel. It doesn't necessarily, but when it is now nearly every day, for a long time, then we begin to say there's a problem here.
Yeah.
Then unexplained weight gain or loss, sleeping too much or too little.
Okay.
And this is really critical.
Yeah.
Because in a lot of the mental health, even common mental health condition, one of the things we notice is lack of concentration and poor sleep, especially in things like depression and anxiety. You notice lack of concentration and poor sleep. Fatigue and lack of energy. So someone is so unmotivated, lack energy, is always tired. Do anything that he used to do, she used to do. Feelings of guilt and worthlessness. So, someone always feeling guilty, always ruminating. Rumination is worry, yeah? But the difference between rumination, the way we call rumination and worry, is most times worry is about the future. It's about what if, the what ifs. But the rumination is about the past. It's about why did this happen to me? Why me? What have I done to deserve this? So somebody spending so much time feeling guilty and ruminating a lot. Or feeling worthless. Being unnecessarily confused without really any biological explanation. Moving and speaking more slowly or much more faster than usual.
Wow. So it's mostly a difference from the norm.
Yes.
Okay.
Restlessness or having trouble staying still and having thoughts of suicide. There are a whole lot of things, always fearful, stomach ache, muscle tension, tightness of the chest. Some people, when they're having panic attack, they think they're having heart attack. But it's until sometimes they call ambulance and ambulance come to pick them, and then they check them, they realize that they're not having heart attack, it is panic. Fear of shame and all those kind of things. There are so many that I can tell you that examples of things to look at.
So what should we do when we see such symptoms? Here we're in UK, do we call the ambulance? Now most of my audience are in Africa. Do they rush that person to the hospital? What should you do?
Okay, so I will address it both ways, both in Africa and in UK.
Okay.
So in the UK, we have GPs, general practitioners,
Yes.
in our wherever we are registered in our surgeries, and also there are a lot of mental health charities like Samaritans, like Mind, all over the place. These are very national charities.
Yeah.
So if somebody is struggling and you notice that things is not quite the way, out of range, this is not the usual behavior of this person, the first thing to do is to talk.
Yeah. Okay.
That's why we say it's good to talk. Talk to someone or talk to the person and say, are you okay? Is everything okay? What's going on? So if the person is able to express what is going on, then you'll be able to figure out how to support the person. But the first point of intervention should be to see your GP.
Okay.
So once you see your GP, then your GP will make an initial assessment of the situation and then decide if it's something that can be managed under primary health care in the GP or something that require higher level intervention from mental health service. So that's for UK.
Okay.
Also, the mental health charities, they're also a very good support system. So if somebody is having some of these symptoms, you can also speak to any of the charities. They'll be able to signpost you. However, I will put another caveat. If somebody is clearly psychotic,
Yes.
or is very, very suicidal, or has attempted to harm themselves in any way, or is a danger to themselves or to other people, then we need to escalate intervention.
Okay.
So in that case, you call emergency.
Okay.
So these days, when you call emergency service, it's not like before where police just come and bang your door. No, these days they will come with a mental health nurse
Okay.
to come and assess the situation. And then the mental health nurse or a clinician will make judgments or what is the immediate intervention. Or if that person can be taken to A&E, that's also another level of intervention that can happen.
Okay.
Now, back in Africa, I want to say something that is really important. Because back home, mental health services is not as developed as it is here. And so a lot of time, every problem is taken to the pastor or to the imam or to community leaders.
Yes.
So what I would say is if somebody is experiencing these things, please, as much as you speak to your pastor and your imam and community leader, try and speak to a professional.
Yeah.
So it's okay to seek counsel, but also speak to a professional. Because there are some things that, yes, your pastor may be able to counsel you or your imam may be able to advise you, but in terms of treatment, it is professionals that will give that treatment.
Yeah.
So it's really important that you speak to a professional. So speak to your doctor, and then your doctor may be able to also signpost you. Back home, we have psychiatric hospitals and all that.
Yeah.
If it's their end, of course,
Yes.
they will. If it's something they can manage by maybe prescribing antidepressants or anti-anxiety, they will manage it. But if it requires escalation, they will escalate it.
Well, back home, like you just said, we'll rather go to our spiritual leaders than go to a professional doctor, and see, maybe this is the origin of why we're not inclined to see professionals. Okay. In fact, I think we Black people, Africans, do not even want to accommodate the thought that we are suffering from mental health illness. So why? I mean, that's what I think. But why do you think this we lack, or we're not able to see ourselves as suffering from mental health difficulties?
Okay, so
I don't know if you get me, because I'm struggling here. Okay,
I get you. I get you. So yes, what the situation back home is, like I said, mental health service is not as developed as it is over here. Like the list I was trying to read through for you, I'm sure back home, if I read through that list, people will like, what are you saying? What does that mean? What does that mean? Okay.
Yeah.
Because it's either the way we define mental health, ill health back home is someone that is clearly psychotic and on the streets.
Yeah. Okay.
That's the manifestation. That's what it looks like.
Okay.
To us back home. But the reality is that there's a lot of people who are experiencing the other end of the common mental health problem, and it is paralyzing them. And a lot of people who end up taking their own life, when you evidence suggests that a significant number of those people were experiencing depression.
Yes.
Not everybody that took their own life, it was a significant does.
Yes.
So that tells you that because of our impression that when we talk about mental ill health, is only someone that is clearly psychotic.
Yes.
People that
we talk about mad people. Yes.
Mad people.
Yes.
We see on the road and all that. That's number one. So that's part of the challenge. The second challenge is that there's a lot of superstitions back home. So when someone is having mental health difficulty or illness, because there's a lack of infrastructure to diagnose these things and the system to that support these things, people are more easily inclined to think in a superstitious way.
Yeah.
About mental health, because don't forget, some of these are things that are evidence based, and when things look mysterious to some people, they cannot explain it. The default position
that which my neighbor or my auntie or my uncle.
Default. Exactly. That is the default position. So until you put things to a rigorous analysis based on evidence, it is likely that people will default to that position. So that's number two challenge. The third challenge, again, in our community back home, because the structures are not there, so the religious leaders actually are doing not only their job, but seem to be extending to do the jobs of the governments and of every other person that the infrastructure is not there for. So they kind of now become experts in everything. So that is part of it. So, but I tell you, it takes a lot to study to qualify for any of these questions. So that's part of the challenge back home. So until we create more and more awareness, and also build the structures, because everybody is like, for example, these common mental health conditions, people don't necessarily need to end up in psychiatric hospital because of common mental health conditions. So we need to build structures to offer psychological therapies and first-line treatment to people in the community. That's why it's called community mental health over here. It's called community mental health. So it's only when it is severe end
that you need to go to the hospitals and
depot injection and all that you need to be admitted. And if here, many times you'll be sectioned many times, or maybe you'll be under voluntary admission, but you cannot be there without treatment. The reason for that is treatment. So, but because we lack the infrastructure and the understanding to support people in the community for the common mental health problem, we see mental health problem only in people that are purely psychotic.
Yeah.
That is a real challenge.
So now you have talked about what we do back home, but then our people here who are here, they still refuse to see their GP. They still refuse therapy. See, this is a big problem for us. If you have a mild issue and you refuse to see your GP, refuse therapy, and you continue carrying it from year to year, wouldn't it end up being a more serious issue where maybe they will section you?
Yeah, actually, evidence again is very clear, even in this country.
Okay.
Where we are just about 3% of the population.
Yes.
However, we are disproportionately represented in the severe end.
Okay.
In the psychiatric hospitals. So especially people from African young males from African Caribbean background.
Yeah.
We are overrepresented on the severe end, and most times evidence also is clear that our people enter that severe end through the criminal justice system.
Okay, so when they are forced and maybe in prison, that's when they now notice that,
or through sectioning.
Yeah.
Not voluntarily, through section.
Yeah.
Through is clearly psychotic,
yeah,
and then they have to be sectioned, against their will to be treated.
Yeah.
That's what section means.
Yeah.
So we detain people under Section 2, Section 3 to treat them under the Mental Health Act.
Yeah.
So the issue here is this. Remember what we just said about where we are coming from.
Yeah.
Our understanding of mental ill health. So change takes time. Change takes time.
Yes.
When people come here, they're still carrying their understanding into their new community. So it does take time before they understand that, no, what you used to see, how you used to interpret things before is different. There are structures here to help you to navigate these things better than where you are coming from. That's number one. Number two is that the way some of the system is built, some of our people find it difficult to navigate it and access it. And some of our people do not know that they can freely go to their GP and open up and talk about their mental health.
Yeah.
Some of them feel that because of the stigma of mental health, that if they talk about it, because they already feel there's a stigma about mental health, both in the community and outside the community, that if they talk about it, maybe it will affect their job, maybe they will take away their children, maybe they cannot do this or do that. So they are unable to go and open up and talk about their mental health. And also, talking about psychological therapies. Again, some of the psychological therapies like CBT are actually, started in the Western world in terms of the evidence that built it up.
Yeah. Sorry. What does CBT mean?
CBT is cognitive behavior therapy.
Very good. Very good. Yeah.
So that's a very popular therapy. There's other therapies like systemic family therapy, psychodynamic therapy, but CBT, cognitive behavior therapy, is quite popular and evidence-based for treating common mental health difficulties.
Yes.
So some of these therapies are actually quite Eurocentric in the way that it was developed.
Okay.
Although there are new adaptations to make sure it fits diverse communities.
Well,
but the thing
sorry. If back home we adopt these things, then we can shape it to suit our people.
Yes, even here now, even before going back home, there are new evidence, new research especially from the Asian community, that is affecting the way that CBT is being developed.
Okay.
There is cognitive behavioral therapy. There is what we call the second wave and the third wave. Some of those waves are improvements on the original CBT therapy.
Okay.
Even in America, there are evidence that group cognitive therapy has been used for African American women and adapted to include their faith and their gender identity,
very good,
their ethnic identity, issues like that, to exploit, to influence the outcome of their therapy.
That's good.
So
that's very good.
These are things happening to make sure that it is inclusive,
yes,
and it is adaptable to diverse communities.
Very good.
So that's what it is. But our people here are still quite not. Again, there's another thing. There has been a history of mistrust of Black people and mental health service.
Yeah.
Because I told you before that we're overly represented in the severe end.
Yes.
So there's also a history of mistrust of the way our people are diagnosed in that severe end.
Okay.
So, like, I used to work in community mental health team, in an adult team.
Okay.
In Northwest London. And I worked in Healing and I worked in Brent. And a lot of my caseload then, people that were diagnosed with schizophrenia, which is a very severe end of the psychotic level, many of them were from our community.
Okay.
So there has been a lot of debate and discussion about why is it that it is more of people from Black, African, Caribbean community that get this diagnosis more in when you look at it in ratio to our population in the country. So there's a mistrust of mental health service from our people as well.
Based on what you just said, maybe because we don't handle the less severe cases when they start coming, and we'll wait for it to blow up to, I'm just saying.
Yeah, that's one part of it. That's one part of it. The other part of it, again, is although things are improving, the other part of it, like I told you, is not always because of the common one that leads to the severe one. Sometimes misuse of substance can lead to that severe one as well. And sometimes some severe violence and traumatic events can lead to those severe ones as well. That's what. Then the other thing again is you need to understand that the way we present as a people is slightly different from the way a typical European presents. So before now, there was a lack of cultural appropriate assessment when these kind of things manifest. So that concept of dangerousness and aggression of a Black male sometimes overtly play out in diagnosis, but not all the time. I'm just saying sometimes. But these days there's more understanding and more culturally appropriate assessment, because the latest amendment to the Mental Health Act is making it a requirement that there has to be cultural advocates for everyone that is detained under the Mental Health Act.
Very good.
So when you are going through tribunal, doing assessment, through review, somebody that understands your culture can interpret what is happening to you. So I'll give you a typical example. Our people attend Pentecostal churches a lot. And there's a normal thing that happens in Pentecostal church. People speak in tongues, for example. So, but for some people, are seeing someone speaking in tongues like that might interpret it differently as deletion. Exactly. So, but if you get someone who is who understands the cultural situation of that person, you may interpret that, oh no, this person is just speaking in tongues. It's just part of it, you know what I mean?
Yes.
So I'm just using it as an example.
That's a very good example.
But when we talk loud. You know,
like me.
We use our hands a lot. You know, we're quite expressive. You know, so somebody can misinterpret it to mean aggression. and then that will inform their judgment of how they assess that person.
Yeah.
So, but if you have someone who is culturally competent in that situation, may say, no, it doesn't mean aggression. It's just the way they express themselves.
Wow. You see, the good thing, like, it shows that the society is adapting to the situation, and that's good. That's good. So that will now enable our people who are here in the UK or other Western countries to seek help whenever they need it, because if it's better for them to seek help early in the process than to wait for them to suffer for a long time, and then yet they will still need help. Because once you suffer mental ill health, I mean, do you think it can disappear by itself?
Okay, so let me explain something. So that's part of the stigma around mental ill health. Yes. People do recover. Recover.
Okay.
In mental ill health, especially the common mental ill health.
Yes.
People do recover and recover fully.
Very good.
But even when people recover and recover fully, they still need to be mindful of how they live their life. They still, it's just like when you've had a physical health condition.
Yeah.
You still need to make some lifestyle adjustments.
Changes. Yes.
Exactly. So the same thing with mental. You still need to maintain your mental health.
Yeah.
You can't take your mental health for granted.
Yes.
So people do recover, and even the severe end, people also recover. The only thing is, you need to, in the process of your recovery journey, you will need to understand your triggers and your early warning signs.
Okay.
And also, recovery itself means different things to different people.
Okay.
So I always describe, especially severe mental health is like learning to dance in the rain.
Okay.
So you have to learn the new dancing step. That's how I describe recovery, especially in the severe end.
Okay.
So I was, because I did a lecture called Introduction to Recovery.
Okay.
When I was working with CNWL NHS Trust in their recovery college. And what I was saying in that lecture was, why I called it like dancing in the rain is because something significant has happened to you.
Yeah.
Especially in the severe end.
Yeah.
Something significant has happened to you. So you got to learn a different way of dancing in the rain. It's no longer the way you used to dance before. You will still dance.
Yes.
But you need to learn a different way of dancing.
Wow.
That's the way I
dance
describe
steps. It. Okay.
Yes.
So, yes, you mentioned that the consequences of us not addressing mental ill health at the beginning it might lead to the more severe kind. Okay. So as individuals, what are some of the things we can do to reduce the onset of mental ill health?
Okay. So in terms of how we, like I said, that we need to look after our mental health.
Yes.
In terms of some of the things that we need to be doing to look after our mental health, number one, we need to look at our values.
Okay.
It's really, really important that we understand what we value and how we prioritize things in life.
Okay.
Because if, for example, your values is all about chasing money all the time and, putting a lot of pressure on yourself to meet people's expectations all the time. You put a lot of pressure on yourself.
Okay.
So you need to set your values right to start with. There has to be a balance in terms of the things that give you sense of achievement and things that give you sense of enjoyment and pleasure.
Okay.
There has to always be that balance. So because if you are driven so hard on the things that give you sense of achievement, you will burn out quickly. And that's what part of what will affect your mental health.
Okay.
If you put too much stress and pressure on you. And if you are not motivated enough, you are only doing things that give you pleasure, only enjoyment.
Yeah.
It's also on the other end.
Yeah.
You will not be motivated to do something meaningful and productive. Remember,
Yes.
I did mental health, because it's ability to do something productive and maintain, cope with normal stresses of life.
Yeah.
So that's one. Two, we need to also get more active. We need to be active because there's exercise helps in releasing what we call the happy hormone.
Yeah.
Getting active is not only about going to the gym. You might be taking a walk, when there's sunshine, take vitamins, take a walk. So that's part of exercise. So because when you say exercise, people think it's only when you go to the gym.
Go to the gym, yeah.
So there are different ways you can exercise. You can run through your staircase, you can do gardening, you can take a walk. There are so many things we can do that is exercise. We need to be connected. We are social beings.
Yeah.
We need to be connected. We need to maintain connectedness with other people.
Yes.
We need to have our support systems. We need to live with other people, try as much as possible to live with other people in harmony.
Yeah.
And try as much as possible to maintain our connectedness.
Yes.
And if you find yourself living in a toxic relationship, regardless of what the shape or form it is, whether it is marriage or boyfriend, girlfriend, or whatever, regardless of the shape, or if work, whatever, but you find yourself staying more in a toxic relationship, is something to review.
Yeah.
Because it will definitely affect your
mental health.
One of the things that impacts significantly on people's mental health evidence is sexual violence. So people need to be very careful, because the trauma of sexual violence lingers long in terms of mental health. And also, we need to eat well.
Okay.
People, when we talk about mental health, people think eating well is only about physical health. No, eating well is also about your mental health.
Yeah.
There are some kind of food you eat that promotes mental well-being. I was treating a young person recently for depression, and towards the end, I was telling her what to be eating to improve her mental health, and she was surprised. And she said to me, "Really?" I said, "Yes." Because there are things that, things that have omega-3, oily fish, nuts, all those things improve your cognition and your mental well-being. So we need to do that. And we need to be able to talk.
Yeah.
We need to talk. Why we've already said there's stigma in about mental health, but we need to break that stigma. By no, it is health, it is ill health. That's what it is, nothing more than that. And people do recover.
Yeah.
So we need to talk. Once you feel that you are being stressed or you are struggling, please talk to someone.
Yeah.
If you cannot find somebody that is informally that you can talk to, there are a lot of charities, like I said, that you can contact your GP and talk to a professional and seek help.
Yeah.
Talk. I cannot emphasize it more. Talk.
Yeah.
That is really key in mental health.
Yeah. See, one thing you said that is very crucial is exercising. 1, 2, we need to leave our house. See, because of this lockdown or of the pandemic, many people have gotten into this pace of watching TV all the time, to be on the laptop all the time. Now, Now, maybe you might say I'm one of those people because I am always doing something, but as soon as I noticed this in the first lockdown, I stopped it, and I tend to leave my home, go outside, walk for at least 1 hour, and I see that the walk, when I come back from the walk, I'm more refreshed, So I think it's something very, very important that we do things that keep us active,
Yeah.
And see, social media is a big, big, big problem.
That's why I said we are social beings. We need to connect with other people.
Yes.
But it's not only connecting, is not just about social media, like you said. It's okay. Social media is a platform for connection.
Yes.
But the physical connection is also very important, and that aspect, like you said, going out for walk, it not only improves your physical health, it improves your mental, it keeps your sanity, it improves your mental well-being. Yeah. And in the process, you see other people, you interact with other human beings.
Yeah. Mm-hmm.
Because this is how we are created from beginning. We are not created, God didn't create us to sit inside our room and lock ourselves in. That's not how, if you look back at the primitive years, that's not how we were created.
No.
But all of a sudden, we are now sitting down one place, looking at the screen. Everything we're doing is now on the screen. So we need to find a way to break it and introduce that element of engaging with other people, interacting with other people.
And really social media, especially for young girls, Instagram affects them so much.
Snapchat.
I mean, I don't do all these things, but I've watched several documentaries that highlight all the things that this media promotes.
If I'm honest with you, the truth is, we have a duty as parents to our young people. This is the world they are born into now.
Okay.
Some of us were not born into this world.
Yes.
When we grew up, there was no Facebook and Instagram and Snapchat when we were teenagers. But this is the world they know that they grew up in. So we have a duty as parents to help them navigate this world.
Yeah.
That they grew up to. We cannot leave it to them totally.
Yeah.
Because they still have teenage brain that is still developing.
Yeah.
So we have a duty to help them to navigate this new world. They may not like it, but we still have to do it because we owe them that as parents. Their brain is still developing. They need enough sleep. I forgot to mention that as one of the ways to look after ourselves. One of the critical things we need to learn to do to look at our mental health is to have enough sleep.
Yeah.
Have regular time to go to bed and have sufficient sleep. For an average adult, it is important we are not sleeping less than 6 hours. It's important.
Yeah.
For teenagers, they need to sleep at least 8 hours. So because their brain is still, being formed and pruning and forming, and it is when you are sleeping that your body is able to happen. So it's really important that teenagers get enough sleep. Very, very important.
Yes. Yes.
So we help them and we let them know the impact of social media. All this body image and is so common now because of the impact of social media.
Yeah. So see, it's clear that our community, both here and back home in Africa, we need more mental health practitioners. Okay. So we should encourage our youths to study courses that leads them to be practitioners in this area. So tell me, I know for a fact that you are like a professional student. Okay, you're always See, this is something I admire you for. You are always studying. You are always studying. I mean, the amount of things you do for you to continue studying just to help people in our community. It's wonderful. So tell my audience, what are the kind of things they need to study if they want to get into to be a practitioner like you?
Okay, so thank you for your good compliment. The thing is that I believe that when you stop learning, you die. That's my personal belief. We as long as we live, we continue learning.
Learning, yeah.
If you stop learning, you die. You die your mind. So learning is a lifelong thing. It's not like when we used to back when once you have your BSc or MSc, that's it. You stop learning. No. Learning is a lifelong thing. So in terms of what you do to get into become a mental health practitioner, a clinician, there are various routes a young person can take, or even an adult.
Yeah.
Because I started training in this field as an adult after I migrated to this country.
Yeah.
So I used to be in the business world with my MBA and doing what I know how to do best in the business world. But after I came here, what I said before, we need to review our values.
Yeah.
And know what matters more to us.
Yeah.
So after I came here, due to my own personal experiences, I reviewed my values and looked at what mattered more to me. And what mattered to me is to help the most vulnerable in whichever way I can. Because I've once been successful and I've once been vulnerable. And I know what it looks like to be vulnerable. So I made up my mind that I will help the most vulnerable. And the most downcast of all the vulnerable is people we look down on as being mad, in quotes.
Yeah.
So that's part of my passion to get down to that point, to lift people up. So that influenced how I began to go into learning about these things. And I also have a passion about children and families.
Yeah.
So those two passions combined together in me working in CAMHS, in Child Adolescent Mental Health Service.
Yeah.
So in terms of learning, there are different routes anybody can take. You can start by studying psychology.
Okay.
That is something that is very popular with a lot of young people.
Yeah.
And other people do. You can also do it. That's Open University. You can even study from anywhere, really. And then the good thing in this country is that you can go to school and study anything at any age.
Yeah.
When I was doing my master's in social work, a lot of people in my class, some were retired police officers, some were lawyers, some were, different professions that they practiced before they came back to study this one again.
Yeah.
Because something happened and they revalued themselves and they felt this is where they will make a difference.
Yeah.
They come back. So you could study psychology. You can study occupational therapy. You can study social work. You can study nursing and major in mental health, in any of these things, first of all. And then you can also go into psychiatry if you want. But these days there's also another level of approved clinicians, which you are not necessarily a psychiatrist, but you're a mental health nurse who has worked a certain level and you're able to retrain to prescribe medications. Just like you do physical health, you can do it in mental health as well.
Okay.
And also there are approved clinicians that are social workers who can also function almost like psychiatrists, but except that they will not prescribe medication.
Yeah.
So that's one level that you can do. Then after you've studied whatever you like to study in your first degrees, especially in the health and social science sector, you can now decide to study a particular therapy, a particular modality. That's how we say it in therapy. There are different modalities. So you could study cognitive behavior therapy like myself, CBT. You can study family systemic therapy. You can study psychodynamic therapy. You can do counseling. You can do clinical psychology. You can do counseling psychology. All these things will lead you, to becoming a clinician in this sector. But it requires a lot of dedication.
Yeah.
It's not like the typical academic courses, because these are things that deal with very vulnerable human life.
Yeah.
So you are really assessed thoroughly. You will be doing it and you'll be assessed, and they will see the outcome of what you are doing before you can be certified to treat people.
Wow.
But it's a very interesting profession.
Yes, it is.
Very rewarding.
It is.
Very rewarding.
It is. It is. Favour, I want to thank you very much for being my guest today. I know it's a very impromptu that when I ask you to come on the show, and you readily agreed. So thank you very much. I hope my audience gain one or two things from listening to you, because this thing, mental ill health, is a serious issue, and we need to take it seriously. Yes, for the quarter percent, 25% of the population who are going through these situations, let's us support them. If you know any, we need to support them and encourage them to seek help. Okay. So, Favour, thank you very much. Thank you very much.
Thank you. I wanted to, whenever we do talk about mental health and all that, I will not leave without saying, if you listen to this podcast and you're triggered in any way, or you feel you need help in any way, please do contact any of the mental health charities. You could call Mind or Samaritans, or you can speak to your GP, but please speak to someone. And I wanted to say also that everybody experiences anxiety or some wobbling once in a while. Anxiety is part of normal human life.
Yeah.
But it is when it begins to cripple your life or affect your day-to-day functioning that it becomes a problem. So don't be afraid, don't be shy, don't be afraid to open up, to talk to someone. So if after listening to this podcast, you feel that there is something you need to talk about, or you're struggling, please do reach out to your GP or contact Mind or Samaritan. Please do so. It's really important.
Wow. Thank you very much. Thank you very much. Bye.
You're welcome. Thank you. Bye.